Did you know that you do not have to cut out carbohydrates to fix your blood sugar? In fact, the fastest way to fix your blood sugars is actually more about adding foods, not eliminating entire food groups like carbs. And I've seen it firsthand. I have hundreds and hundreds of patients who've turned their numbers around in just days by adding these foods to their regimen. And not just temporarily, they're still able to keep their sugars low without medications for months and even years. So in this video, I'm going to show you how to use each of these 10 foods to fully optimize your biochemistry and reverse insulin resistance on a cellular level, so you can bring down your sugars quickly and naturally, and most importantly, sustainably. Okay, first is fenugreek seeds, which a lot of people use it as a spice or as an herb, but it has powerful effects on glucose metabolism. So what gives fenugreek seeds its medicinal properties? It's a compound called 4-hydroxyisoleucine, which is a rare amino acid that stimulates beta cells in your pancreas to release more insulin. And more importantly, the insulin is only released when blood sugar is elevated, so it helps with insulin response without causing hyperglycemia or low blood sugars. And more importantly, this compound also enhances insulin receptors, so it triggers glucose uptake in our muscle cells. So unlike many diabetes medications, where you get an inappropriate insulin response, with fenugreek seeds, you get more of a targeted insulin secretion, where your pancreas just becomes more efficient and more responsive to excess glucose in the bloodstream. And it's not just insulin release. Another important reason why fenugreek seeds are so powerful is they're loaded with galactomannan, which is a type of soluble fiber that can form in a gel in your gut. And that gel slows down the absorption of glucose, so it helps with that post-meal glucose spike. And we have studies like this meta-analysis from 2020 that show that fenugreek seeds can reduce fasting blood sugar, and they reduce hemoglobin A1C and even LDL cholesterol. And the benefits don't just stop with blood sugar control. There's meta-analyses that show that fenugreek seeds can be helpful with blood pressure, and they can even help with testosterone levels in men. So how do you actually use fenugreek seeds? Well, the easiest way is to soak about 1 teaspoon of seeds overnight, and then drink the water and chew those seeds first thing in the morning. Now, most studies use doses anywhere between 5 to 20 grams, but the dose may be different depending on if you're using an extract powder or germinated seeds. And I always recommend starting at the lower dose and then slowly work your way up, and that way you can avoid potential gastrointestinal side effects. And by the way, both the positive effects and the negative side effects can be pretty powerful. So I would definitely discuss it with your doctor before adding this to your regimen, especially if you're taking diabetes medications, as that combo can drop your blood sugar to unsafe levels. And I would also try to avoid it in pregnancy. And even though some recommend fenugreek seeds to help stimulate breast milk production, we actually do not have any good safety data to determine whether any of those fenugreek compounds can be passed on to the baby in the milk. So I would recommend against using it in breastfeeding as well. Oh, and this is important. There may also be some cross-reactivity with peanuts and soybeans, so I would be careful if you have any of those allergies. Next, we need to talk about cinnamon, which is nature's blood sugar modulator. And some even describe cinnamon as your natural insulin sensitizer. And here's why it's so important. When you eat, your body breaks down food into glucose. And insulin is that hormone that helps shuttle that glucose from your blood into your cells. But when you develop insulin resistance, like in diabetes or prediabetes, well, this is where your cells basically stop responding to insulin. So your blood sugar stays high, and you start this destructive cascade of inflammation and oxidative stress and damage to your blood vessels. So this is where cinnamon can help, and it can help in many different levels. Most importantly, cinnamon works because of an active compound called cinnamaldehyde, which activates a special cellular pathway called IRS1-PI3K, which is the pathway that your cells use to respond to insulin. So a good analogy for this is if your insulin receptors are locks, and your insulin is the key to that lock, in a state of insulin resistance like in diabetes or prediabetes, these locks are rusty and they don't work that well. But cinnamaldehyde is what helps polish and oil those locks so they can work better, and they can unlock the gates to let in more glucose into the muscle cells. But that's not all. Cinnamon also slows down gastric emptying, which gives your pancreas more time to release insulin, and this allows your tissues more time to respond. And that's because cinnamon also inhibits enzymes like alpha amylase, which is responsible for breaking down complex carbohydrates into simple sugars. So basically, you slow down the release of the glucose into the bloodstream while simultaneously helping shuttle more glucose out of the bloodstream and into the muscle cells. And there's a recent meta-analysis published in 2024 that looked at 24 randomized control trials, and it showed that cinnamon supplementation reduced fasting blood sugar, and A1C even reduced markers of insulin resistance. Now, a typical dose used in studies is about 1 to 2 grams per day, which is about half a teaspoon. Now, the two main forms of cinnamon are cassia cinnamon and Ceylon cinnamon. And I personally prefer Ceylon cinnamon because cassia cinnamon contains coumarin, which is a compound that can be toxic to the liver at high doses. But with any of those supplements, you have to watch out for heavy metals content and purity. So whichever supplement you pick, just make sure that it's third-party tested or it has CJMP certification. And by the way, if you are taking a supplement, let me know in the comments below which one you're taking and why, so we can all learn from each other. Next up is grass-fed beef. And yes, red meat can lower your blood sugar, but it has to be the right kind. So we have studies like this one that show that grass-fed beef contain a higher concentration of omega-3 fatty acids, and particularly alpha-linoleic acid and conjugated linoleic acid. And these fats can help us improve insulin sensitivity. In fact, conjugated linoleic acid acts on the same PPAR gamma receptor that is targeted by a diabetes medication called pioglitazone, or another name for that is Actos. And activation of those receptors gives us enhanced glucose uptake into our muscle cells, and it lowers liver glucose production. Now, beef is also rich in L-carnitine, which helps shuttle fatty acids into mitochondria, so they can be burned for energy instead of accumulating as fat in the liver. And on top of that, beef has vitamins and a lot of important micronutrients like vitamin B12 and iron and zinc, which are all critical cofactors in energy metabolism. Now, there's a lot of nuance to when it comes to potential benefits and risk when it comes to eating too much red meat. And my general recommendation is red meat is great if it's not processed, but I wouldn't overdo it. And I would always try to pair my red meat with lots and lots of fiber. And by the way, there's another food that also acts on that PPAR receptor, and that is avocados. And avocados are an amazing food when it comes to glucose metabolism. They're rich in oleic acid, which is a monounsaturated fat that improves lipid metabolism. And essentially, it helps you burn more fat and it reduces liver fat. And both of those are key contributors to insulin resistance. And avocados are also rich in potassium, which is absolutely essential in maintaining proper cell membrane function, and it helps with insulin release. And on top of that, avocados also help with satiety and feeling full. And we have studies like this one that show that adding just half of an avocado to a meal can improve satiety up to 3 to 5 hours afterwards. Now, another powerful food that we have to talk about is broccoli sprouts. And it's a tiny plant, or actually it's just the baby version of regular broccoli. But broccoli sprouts have the ability to completely reprogram your metabolism. And that is because they're rich in sulforaphane, which is an antioxidant that can actually change how your body handles glucose on a cellular level. So the way it works is sulforaphane activates NRF2, which is a transcription factor that acts like your body's internal thermostat for inflammation and oxidative stress. And when this NRF2 transcription factor is switched on, it turns on a whole network of genes that can protect your mitochondria and reduce inflammation. And sulforaphane also tells your liver to stop producing new sugar when the levels are already high, which is actually how a drug called metformin works. It stops gluconeogenesis, or production of sugar, by the liver. So this is why broccoli sprouts are so powerful. They help both at the muscle level, where more glucose needs to get in, and then they help at the liver level, where they tell the liver to stop producing so much glucose. And the best part is broccoli sprouts contain 20 to 100 times more sulforaphane precursors than mature broccoli. So even a small handful of broccoli sprouts can give you therapeutic effects that you would never get from a full plate of cooked broccoli. So all you need is just half a cup of fresh broccoli sprouts per day, ideally raw, and you can eat them as part of your salad, or you can blend them in a smoothie. And the key thing here is consistency, as sulforaphane has a very short half-life. So we just need to give our body a steady supply every day, or most days, for as long as we can. Now let's talk about chia seeds. And the magic with chia seeds happens when you soak them in water and they form this viscous gel. And this gel can physically slow down the digestion and absorption of all the carbohydrates in your gut. So it basically acts like a speed bump on this glucose highway, where you may still get the same amount of sugar entering your bloodstream, but at a much more gradual pace. And that's what prevents sharp glucose spikes after meals. But that's not all. Chia seeds are also rich in alpha-linolenic acid, which is a plant-based omega-3. And that omega-3 is what helps us improve insulin sensitivity by reducing chronic inflammation. And there's a recent meta-analysis that looked at over 210 participants that show that chia seeds can significantly decrease CRP, which is a major marker of inflammation. Now let's talk about one of the most unfairly demonized foods that will actually help you lower your blood sugar, and that is eggs. And eggs are probably one of the most nutrient-dense foods that you can eat, and it's packed with protein and it's full of healthy fats. But it's the micronutrients in eggs that are so important, specifically choline and leucine. And choline helps us move fat out of the liver, which helps restore normal insulin sensitivity. And leucine, which is just an amino acid, is what helps our bodies build lean muscle. And the more muscle mass you have, the better you're able to clear out excess glucose out of your bloodstream. Now, another staple that you need to add to your routine to drop your blood sugars would be fatty fish. So it would be fish like salmon and mackerel and sardines. And fatty fish is one of the best sources of omega-3 fatty acids, especially EPA and DHA. And these omega-3s are biologically active compounds that can actually change how your cells behave. And what they do is they reduce chronic and background inflammation, which is a major driver of insulin resistance. So the less inflammation you have, the better your cells get at responding to insulin, and they get better at clearing out excess glucose. And we have studies like this randomized control trial that show that high intake of fatty fish of at least 750 grams per week for a week significantly improved postprandial or after-meal glucose regulation. Okay, let's talk about walnuts, which actually have some of the most fascinating effects on blood sugar regulation out of all of these foods. So first, walnuts increase a very special hormone in your body called adiponectin, which is absolutely essential in glucose control. And there's a randomized control trial that showed that just 16 weeks of daily walnut consumption improved adiponectin levels, and it improved fasting glucose. And walnuts are also rich in magnesium, which is incredibly important to maintain that insulin receptor activity on a cellular level. And on top of that, walnuts are a great source of omega-3 fats, especially alpha-linolenic acid, which helps stabilize that cellular membrane around those insulin receptors. So they work more efficiently at responding to insulin, and they do a better job at disposing excess glucose. Okay, this is one of my favorite foods to help lower your blood sugar, and that is chickpeas. And like many other foods on this list, chickpeas improve your blood glucose control by several different mechanisms. So on a biochemical level, chickpeas are rich in something called amylose, which is a type of resistant starch. So this is in contrast with rapidly digestible starches, like what you find in white bread or pasta. And amylose is digested very slowly, so it helps blunt that glucose spike. And chickpeas also contain fermentable fiber, which your gut bacteria can actually convert into short-chain fatty acids like butyrate. And butyrate is extremely important because it strengthens that gut barrier and reduces inflammation and improves your AMPK function, which is basically an enzyme that prompts your body to utilize glucose more efficiently. And just like with broccoli sprouts, if you want to use chickpeas therapeutically or use it as a medicine, well then, you can't just eat them once in a while. You have to incorporate them into your routine any way you can. So you can add them to your salads or soups, or you can eat as hummus. And I would try to eat at least 1 cup of chickpeas a few times per week, which will allow you to restore your gut health and will retrain your body on how to process sugars more efficiently. That's all today. All right? If you're looking for more tips on how to live your best life, make sure you hit that subscribe button so you don't miss a beat. I'm here for your health. Thank you for listening, and see you again in the next video. Wishing you great health, wealth, and happiness.